Pharmacogenomics is the science of how people respond to medications based on their genetics. So I am a pharmacogenomics pharmacist at St. Elizabeth Healthcare, and we look at, we sort of help providers select the right medications for individuals based on genetic testing that we do. I love it because it's something that we're able to bring some science to the medication trial and error process, and really help select medications that are going to be more likely to work for people, less likely to cause side effects. So pharmacogenetic testing is really simple. It's a cheek swab that can be done right in your provider's office. So they'll take a cheek swab, they'll send it to the laboratory. Those results will get turned around in about a week. They'll come to us as the pharmacogenomic pharmacist. We'll review those results and make the recommendations back to the provider. Some of these things we've known about, in some cases for hundreds, if not thousands of years. There are cases all the way back to ancient Greece where they identified that certain people would not respond to certain medications and that it could travel within families. And so some of this stuff we've known for a really long time. 2001, the Human Genome Project took 10 years, $3 billion to sequence that whole human genome. Our testing now, we're only looking at a piece of the genome, but we've got it down to under $350 for most patients. So there are about 100 or so medications that we can look at. Some of these are medications that are used in very specific circumstances, so certain types of cancer or certain types of infectious disease, but some of them are really common medications that we see patients on every day. Antidepressants, anxiety medications, statins for high cholesterol, heartburn medications like PPIs. So these are medications that many patients are on, if not most patients are on. Genetics is sort of one piece of the puzzle. As a pharmacist, I think about a lot of different things that influence medication response. Your age, your sex, your diagnoses that you might have, other drugs you're taking, foods that you're taking, are you a smoker or not? All these different things can influence drug response. Genetics is one more piece that we can add to that puzzle that gives us a bigger picture. We're doing something really exciting at St. Elizabeth, which is working to put this stuff into our medical record so that these results can be used across the patient's across the health of the patient as well as throughout their lives. Although you might be ordering it for a mental health medication today, we'll be able to inform on the heart disease medication that you're going to be prescribed 5 years from now. So this is a way that we can start to do preventative healthcare, being proactive about medicine selection, so that we're really moving forward in terms of getting patients better as quickly as possible.